Hello everyone, welcome to sqadia.com. This is Dr. Sana Khan today with exciting lectures about the anatomy. We will be discussing about the basic anatomy and some of the clinical important structures and their application in clinical anatomy as well. Before going into the detail of every little structure like bones and the muscles, I just want to give you the overview of the musculoskeletal system of the human body. So we actually know that the human body is actually made of cells and combine together to form the organs, and then organs combine together to form the systems, and the systems, they work simultaneously together with specified mechanisms, and they form a human body with physiological mechanisms and phenomena taking place in it. Now, there are some supporting structures in the body, and there's some important basic structures like the muscles, the bones, the joints, the tendons, and the ligaments. Now, when you talk about the anatomy, so basically the anatomy is the study of the structures which are making up a human body, or particular structures or muscles, or the systems actually. So when you talk about the anatomy, we divide the musculoskeletal systems into the axial skeleton, and then you have the appendicular skeleton. So axial means when you talk about the axial skeleton or axial system of the body. So that's actually made up of the skulls, as you can see in this diagram, that this is the skull with the different orbits and foramens and the structures. And then you have the central part, which is the sternum, the cervical spine. Then you have this rib cage, which is formed not only by the ribs, but also the costal cartilages. Then you have the clavicle and the scapula. So they all together, they make the axial skeleton. That means that the center of the body, right? For the weight transmission and for the weight bearing, and responsible to hold a body into a specific shape. So we have the skull, we have the sternum, we have the clavicles, we have the scapula, we have the ribs, and along with the ribs, we have the costal cartilages. They make the axial skeleton of the human body. Now, when you talk about the appendicular skeleton, so appendicular comes from the word appendages. So by appendages, we mean the limbs. So you have the hands, you have the arm, forearm, you have the legs, the thighs, the foot. They are actually making up the appendicular skeleton. So remember, two important division. That is, one is the axial skeleton, which is actually making up the central part of the human body or a human skeleton, and is responsible for the weight transmission, for the weight bearing of the whole of the body. And then you have the appendicular skeleton, which consists of the appendages like the upper limb, the lower limb, the foot, and the hands, which are responsible for the different functions of the human body. Now, when you talk about the appendicular skeleton, we have the scapula, we have the clavicle, we have the sternum bone, and the ribs, and the costal cartilages in the skull. So we will be discussing these bones one by one, their important basic anatomy. Then we will be talking about the different structures which are related to the bones, or the muscles which have origin or insertions on that particular bone. And then their surfaces, their ligaments, and then we will be talking about their movements and the weight-bearing phenomena or weight-bearing function of that particular bone. So today we'll be talking about the clavicle, its basic and the clinical significance. So let's start with the clavicle anatomy. Okay, so it's the most important bone in the body. So when you talk about the bones in the body, so there are long bones, there are short bones, there are flat bones, there are triangular bones, okay? So the long bones are the one like the humerus, the radius, and the ulna. These are the long bones. And when you talk about the short bones, like the carpal bones, like the metacarpals, phalanges, the tarsal, the metatarsals, so they are actually the short bones. Then you have the sesamoid bone, bones, which are basically inside the cartilaginous rim. They're cartilaginous bones actually, and they are covered by the tendons. So when you talk about the clavicle, clavicle is a flat bone, and it's one of the smallest flat bone in the body, right? So when you talk about its attachment, it has a medial attachment, as you can see on your screen, and it's a lateral attachment. So when you talk about the medial attachment, it's actually going and attaches itself. The medial end is attaching to the sternum. You can see the body of the sternum. And then you have, sometimes it also have the attachment to the first rib, okay? So just see the rib cage. So this is actually the first rib, the second rib, third, fourth, fifth, sixth, and so on. And you can see the sternum as well. So the medial end of the clavicle is attaching to the sternum and crossing over the first rib, and the lateral end attaches to the acromion process of the scapula, which is a triangular bone, and it's also part of the shoulder girdle. Now, these two important bones, it's important to understand that clavicle and scapula, these are the most important bones, and they are a part of a shoulder girdle. They're making up a shoulder girdle, okay? So what actually does it mean that's the shoulder girdle? So that's mean there are some kind of movements, like, rotational movements, and a forward bending and a backward bending, and their abduction and adduction movements. So they're all taking place at the shoulder joint and the shoulder girdle. So when somebody asks you about a shoulder girdle, remember the clavicle and the scapula, they combine together, and their articulation makes up the shoulder joint, and this is a part of a shoulder girdle. So important is that it attaches to the upper limb, to the trunk, as part of the shoulder girdle, right? So this is actually the upper limb, and this is the central axial skeleton of the body. So you can say that it's a link, or it's an attachment between the axial and the pendicular skeleton, right? Remember the medial end and the lateral end. So medial end has attachment with the sternum, and the lateral end has the attachment with the acromion process of the scapula. It's a slender S-shaped bone, and it's the only horizontal bone in the body, and it's also called as a beauty bone, or a collarbone, or a subcutaneous bone. And there are important muscles which are attaching to the clavicle, but remember there is no fascia covering the clavicle. Just it's only covered by the skin, and it's also called as a subcutaneous bone because it immediately lies the skin and the subcutaneous tissue. So it's a flat bone, and the important thing about this bone is the ossification. So when you talk about the bones, I'm not going to go into the detail of their ossification process, but remember there are some membranous bone and there are some cartilaginous bones. Some have the membranous ossification, and some has the cartilaginous ossification centers. I'm not going to go into the details, but remember it's a slender S-shaped bone. That means the inner or the medial surface is convex backward, and the outer surface or a lateral surface is concave forward. Okay, so it has both convexity and a concavity. The medial end is convex backward, and the lateral end is convex forward. I told you about that. It's a flat bone, it's a long horizontal bone, and it's a subcutaneous bone. It's also called as a beauty bone or a collarbone. And remember the attachments, the medial is to the sternum and the lateral one is to the acromion process of the scapula. Okay, so now talking about the main functions of the clavicle. Bones, they come into action, or they're responsible for the particular function of the joint. Okay, so it's also taking part in it's making a acromioclavicular joint, and then you have a sternoclavicular joint, and there are some movements which are possible on the sternoclavicular joint and the acromioclavicular joint. So acromioclavicular joint is the one on the lateral side, as you can see on the diagram. This is actually the part of the lateral part of the clavicle. It's acromion, so it's an acromioclavicular joint. And the other one is the medial one, and it's the sternoclavicular joint. Now, when you talk about the movements, there are some important muscles which are attached to the clavicle, maybe to the superior surface, or some of them are attached to the inferior surface. Some of them are attached to the this sternoclavicular joint, and there are some important ligaments. The main important part, or you can say the function of the clavicle, is it acts as a mechanical barrier. The number one thing is that it's a potential attachment between the axial and the pectoral or skeleton system. The other part is that it's a mechanical barrier. So almost the upper body weight, which is being transmitted, it comes onto the clavicle. So that's why the clavicle is the most exposed bone, okay? So whenever there is an outstretched hand, there's a fall on the ground, there is a possibility that there would be a fracture of the clavicle. Besides that, there are some important structures which are located on the neck, and the cords of the brachial plexus, and then you have the important vascular structures like the subclavian vein and the subclavian artery, which are located down here. So it's a part of the protection system as well. So two important functions is the movement of the upper limb and the shoulder girdle, and there are some important structures like the deltoid is attaching to the clavicle. Then you have the trapezius muscles, and then you have the pec major muscles as well. So the important origin and insertion of some of the muscles lies in the clavicle, and that's why it is helpful in the movement as well. Then we already talked about the mechanical barriers. It's a mechanical barrier, and it's a weight transmitting bone, and a connection or a link between the axial and the appendicular skeleton. So remember, number one is movement, and the number two is mechanical barrier. So regarding the movement, already told you about the weight transmission and prevents the drooping. Okay. One important structure which attaches to the clavicle is the sternocleidomastoid muscle. So we all know that the flexion, the lateral and the medial rotation of the neck, or when you're moving your neck to the right side or moving your neck to the left side. So the movement is taking place at this sternoclavicular joint, and this sternoclavicular joint is attaches to the clavicle. So it actually, when the clavicle is intact and there's no fracture, it prevents the drooping. Okay, so but when the clavicle would be fractured, the medial end would be pulled upward. There would be upward displacement of the clavicle because of the sternocleidomastoid, and the deltoid is attaching to the lateral part of the clavicle. So what will happen that the lateral part will droop inward and downward. So clavicle, if intact, it prevents the drooping. It is an important bone for the vein transmission. It also allows a free movement of the arm on the shoulder girdle typically. So these are important movements and important functions which are because of the clavicle. Then you have a mechanical barrier, already discussed about the neurovascular structures. You have a brachial plexus, the cords of the brachial plexus, then you have the subclavian artery and a subclavian vein, which are the most important structures lying in that particular area. So they're also protected by the clavicle, so it acts as the mechanical barrier. There are a few important points to remember about the clavicle, that it has no medullary cavity. Okay, so when I talk about a medullary cavity, you should know that if you go into the detail of the structure of the bone, so we all know that there is a compact bone, then there is a spongy bone which is inside, and then there is a bone marrow in a medullary cavity. Okay, so compact bone is the outer bone, then the spongy bone is inside, then the bone marrow with the medullary cavity. But in the clavicle, there is no medullary cavity. And when you talk about the ossification, it is the first bone to start ossification, and then it's the last one to stop ossification. And the last one, the age for the ossification is up to 21 years. Okay, so it's the first bone to start ossify, and it's the last bone to stop ossification, that is up to 21 years of the age. And it has the only long bone which has two ossification centers, like we talk about the membranous and a cartilaginous ossification, and chondrous ossification and membranous cartilaginous or ossification. So it has both the centers for that. Okay, so remember, one is that no medullary cavity. It's the first bone to start ossify. It's the last bone to stop ossification, that is up to 21 years of the age. And it's the only long bone with the two ossification centers. Okay, so remember, the clavicle is a part of a shoulder girdle along with the scapula. It has a medial end, it has a lateral end. Medial end is attaching to the sternum. Lateral end attaches itself to the acromion process of the scapula. The medial part, it is convex backward, and the lateral part is concave forward. And there are important muscles which are attaching to the clavicle. It acts as a mechanical barrier to the important neurovascular structures. It is responsible for the attachment of the axial skeleton with the pandicular skeleton, and is also responsible for the weight transmission at the upper limb and the free arm movement. And when you talk about important points to be remembered about the clavicle, is first bone to start ossification, last bone to stop ossification, that is up to 21 years of the age. It's important, and then you have the only long bone with the two ossification centers.